Hello, I'm Nurul Athar, PMP CPOE and retired certified, and welcome to my presentation. In this presentation, I'm going to explain 150 most common healthcare IT abbreviation at its meaning. So let's start. AHIMA, American Health Information Management Association. The American Health Information Management Association is a professional association for health professionals involved in the health information management needed to deliver quality health care to the public. ASP, Application Service Provider. An application service provider is a business providing computer-based services to customer over a network, such as access to particular software application using a standard protocol. ALOS, Average Length of Stay. Average length of stay. The average length of stay is calculated by adding the total length of stay for each discharged resident in the month and dividing by the number of discharged residents in a month. The average length of stay can be calculated for the entire facility or by specialty unit per program. A/R, Account Receivable. Accounts receivable are legally enforceable claims for payment held by a business for goods supplied or services rendered that customers have ordered but not paid for. These are generally in form of invoices raised by a business and delivered to the customer for payment within an agreed time frame. ABN, Advance Beneficiary Notice. You may get a written notice called an Advance Beneficiary Notice of Non-Coverage (ABN) from your doctor, other healthcare provider or supplier if you have original Medicare and your doctor, provider or supplier thinks Medicare probably or certainly won't pay for the items or service you got. AHRQ, Agency for Healthcare Research and Quality. The Agency for Healthcare Research and Quality is one of 12 agencies within the United States Department of Health and Human Services. The agency is headquartered in North Bethesda, Maryland, a suburb of Washington, D.C. ARRA, American Recovery and Reinvestment Act. The American Recovery and Reinvestment Act, ARRA, was a massive round of federal spending intended to create new jobs and recover jobs lost in the Great Recession of 2008. This government spending was to compensate for a slowdown in private investment in that year. ASTM, American Society for Testing and Materials. ASTM International, formerly known as American Society for Testing and Material, is an international standards organization that develops and publishes voluntary consensus technical standards for a wide range of materials, products, systems, and services. ACA, Affordable Care Act. The Affordable Care Act, ACA, also known as Obamacare, was signed into law in March 2010. It was designed to extend healthcare coverage to millions of uninsured Americans by legally requiring them to buy health insurance. ACO, Accountable Care Organization. Accountable Care Organization, ACOs, are the groups of doctors, hospitals, and other healthcare providers who come together voluntarily to give coordinated high-quality care to Medicare patients they serve. API, Application Program Interface. API stands for Application Program Interface. An API is a software intermediary that allows two applications to talk to each other. In other words, an API is the messenger that delivers your request to provider that you are requesting it from and then delivers the response back to you. BHIE, Bidirectional Health Information Exchange. Bidirectional Health Information Exchange is a series of communication protocols developed by U.S. Department of Veterans Affairs, VA. It is used to exchange healthcare information between VA healthcare facilities nationwide and between VA facilities and Department of Defense healthcare facilities. BHIE is one of the most widely used healthcare data exchange systems in routine healthcare use and is used to facilitate healthcare data exchange associated with the patient's medical record. BPM, Business Process Model. Business process modeling in a business process management and systems engineering is the activity of representing processes of an enterprise so that Current process may be analyzed, improved, and automated. CMS. Centers for Medicare and Medicaid Service. The Centers for Medicare and Medicaid Services is a federal agency that administers nation's major healthcare programs, including Medicare, Medicaid, and CHIP. It collects and analyzes data, produces research reports, and works to eliminate instances of fraud and abuse within healthcare systems. CCHIT. Certification Commission on Health Information Technology. The Certification Commission for Healthcare Information Technology (CCHIT) is an independent, not-for-profit group that certifies electronic health record (EHR) and networks for health information exchange (HIE) in the United States. CCHIT's state mission is to speed the adoption of health information technology (CIS), Clinical Information System. CIS is an array or collection of applications and functionality, amalgamation of systems, medical equipment, and technologies working together that are committed or dedicated to collecting, storing, and manipulating healthcare data and information and providing secure access to interdisciplinary clinicians navigating the continuum of client care, designed to collect patient data in real time to enhance care by providing data at the clinician's fingertips and enabling decision making where it needs to occur at the best site. CAHIIM. Commission on Accreditation for Health Informatics and Information Management Education. The Commission on Accreditation for Health Informatics and Information Management Education is the accrediting organization for degree granting programs in health informatics and health information management. CHIM. Commission on Certification for Health Information Management. The Canadian College of Health Information Management is certifying body for health information management (HIM) professionals. Candidates who successfully write the Certified in Health Information Management (CHIM) National Certification Examination (NCE) earn a CHIM professional designation. This examination assesses the entry-level competencies of graduates of accredited HIM programs. CPT. Current Procedure Terminology. Current procedure terminology is a set of course description and guidelines intended to describe procedures and services performed by physicians and other healthcare providers. Each procedure or services is identified with a 5-digit code. CCD. Continuity of Care Document. The Continuity of Care Document CCD is a joint effort of HL7 International and ASTM. CCD fosters interoperability of clinical data by allowing physicians to send electronic medical information to other providers without loss of meaning and enabling improvement of patient care. CDA. Clinical Document Architecture. The HL7 Clinical Document Architecture is an XML-based markup standard intended to specify the encoding, structure, and semantics of clinical documents for exchange. In November 2000, HL7 published Release 1.0. The organization published Release 2.0 with its 2005 normative edition. C-CDA. Consolidated Clinical Document Architecture. First we'll see CDA. The schema for structured documents. The HL7 Clinical Document Architecture is a document markup standard that specifies the structure and semantics of clinical documents for the purpose of exchange. C-CDA defines set of CDA documents. The HL7 Consolidated CDA is an implementation guide which specifies library of templates and prescribe their use for a set of specific documents type. CCR. Continuity of Care Record. Continuity of Care Record is health record standard specification developed jointly by ASTM International, the Massachusetts Medical Society, the Healthcare Information Management System Society, the American Academy of Family Physicians, the American Academy of Pediatrics, and other health informatics vendors. CDC. Centers for Disease Control. The Centers for Disease Control and Prevention is National Public Health Institute in United States. It is United States federal agency under the Department of Health and Human Services and is headquartered in Atlanta, Georgia. CDS. Clinical Decision Support. A clinical decision support system is a health information technology system that is designed to provide physicians and other health professionals with clinical decision support. It is assistance with clinical decision making tasks. CHIP. Children's Health Insurance Program. Insurance program that provides low-cost health coverage to children in families that earn too much money to qualify for Medicaid but not enough to buy private insurance. In some states, CHIP covers pregnant women. COTS. Commercial off-the-shelf. COTS. Commercial off-the-shelf software products that are ready-made and available for sale to the general public. Implementation of commercially available technologies for traditionally customized application, usually built by a third-party vendor. Cards can be purchased, leased, or even licensed to the general public. CIO. Chief Information Officer. The Chief Information Officer, CIO, oversees the people, processes, and technologies within a company's IT organization to ensure they deliver outcomes that support the goals of the business. CMIO. Chief Medical Information Officer. A Chief Medical Information Officer, or CMIO, essentially serves as the bridge between medical and IT department at a healthcare organization. This person may also be referred as the Director of Medical Informatics or Health Informatics, working with senior leadership to create a strategic plan for IT. CDR. Clinical Data Repository. A clinical data repository or clinical data warehouse is a real-time database that consolidates data from a variety of clinical sources to present a unified view of a single patient. CDSS. Clinical Decision Support System. A clinical decision support system is a health information technology system that is designed to provide physicians and other health professionals with clinical decision support. It is assistance with clinical decision making tasks. CPOE. Computerized physician order entry or computerized provider order entry. Computerized physician order entry, sometimes referred as computerized provider order entry or computerized provider order management, is a process of electronic entry of medical practitioner instruction for the treatment of patients under his or her care. CARF, CARF. Commission on Accreditation of Rehabilitation Facilities. The Commission on Accreditation of Rehabilitation Facilities is an international non-profit organization founded in 1966 with assistance of Mary E. Switzer, then U.S. Social and Rehabilitation Services Commissioner. For some institutions, it represents an alternative to Joint Commission certification. CAC. Computer Assisted Coding. Computer Assisted Coding, CAC, has the ability to accurately generate medical codes directly from clinical documentation with computer assisted coding. Healthcare organizations can become more compliant with peer and quality reporting requirements while also improving their bottom line. DEEDS. Data Element for Emergency Department Systems. Data Element for Emergency Department Systems, Release 1.0 DEEDS, is intended for use by individuals and organizations responsible for ED record system. If the recommended specifications are widely adopted, then problems such as data incompatibility and high cost of collecting, linking, and using data can be substantially reduced. EHR. Electronic Health Record. Both an EMR and EHR are digital records of patient health information. An EMR is best understood as digital version of patient chart. By contrast, an EHR contains the patient's record from multiple doctors and provides a more holistic long-term view of patient's health. EMR. electronic medical record. The EMR or electronic medical records refers to everything you find in paper chart, such as medical history, diagnosis, medication, immunization, dates, allergies. While EMRs work well within a practice, they are limited because they don't easily travel outside the practice. In fact, the patient's medical record might even have to be printed out and mailed for another provider to see it. EMRAM EMR Adoption Model. The HIMSS Analytic Electronic Medical Record Adoption Model EMRAM incorporates methodology and algorithm to automatically score hospitals around the world relative to their electronic medical records capabilities. FHIR FHIR Fast Healthcare Interoperability Resources. Fast Healthcare Interoperability Resources is a standard describing data, formats and elements and an application programming interface for exchanging electronic health records. The standard was created by Health Level 7 International Healthcare Standards Organization HHS, Department of Health and Human Services. The United States Department of Health and Human Services, also known as the Health Department, is a cabinet-level executive branch department of U.S. federal government with the goal of protecting the health of all Americans and providing essential human services. OCR-HHS Department of Health and Human Services, Office for Civil Rights. HHS enforces federal civil rights laws that protect the rights of individuals and entities from unlawful discrimination on the basis of race, color, national origin, disability, age, or sex in health and human services. ONC Office of National Coordinator of Health Information Technology. The purpose of ONC is to promote a national health information technology HIT infrastructure and oversee its development for healthcare providers. ONC is associated with nationwide efforts to provide electronic health records EHR to patients as a way to better curb medical errors and eliminate paper records. HL7 Health Level 7. The Health Level 7 International is a non-profit ANSI accredited standards development organization dedicated to providing standard solutions that empower global health data interoperability. The 2.x version of the standards are the most commonly used in the world. ICD International Classification of Disease. The International Classification of Disease is a globally used diagnostic tool for epidemiology, health management, and clinical purpose. The ICD is maintained by World Health Organization, which is directing and coordinating authority for health within United Nations system. IOM Institute of Medicine. The National Academy of Medicine NAM, formerly called the Institute of Medicine IOM, is an American non-profit, non-governmental organization. The National Academy of Medicine is a part of National Academies of Sciences, Engineering and Medicine, along with National Academy of Sciences, National Academy of Engineering NAE, and the National Research Council NRC. The National Academy of Medicine provides national and international advice on issues relating to health, medicine, health policy, biomedical science. It aims to provide unbiased, evidence-based and authoritative information, advice concerning health and science policy to policymakers, professionals, leaders in every sector of society and the public at large. IT Information Technology. Information technology is the study, design, development and implementation, support or management of computer-based information systems, particularly software applications and computer hardware. IT workers help ensure that computers work well for people. IHE Integrating the Healthcare Enterprise. Integrating Health Enterprise is a non-profit organization based in United States of Illinois. It sponsored an initiative by healthcare industry to improve the way computer systems share information. IHE was established in 1998 by a consortium of radiologists and information technology experts. ICPC International classification of primary care. The international classification of primary care is classification method for primary care encounters. JCAHO, Joint Commission on Accreditation of Health Care Organizations. The Joint Commission, also known as TJC, is a United States-based non-profit, tax-exempt 501 organization that accredits more than 22,000 U.S. healthcare organizations and programs. The international branch accredits medical services from around the world. HIE, Health Informatics. Healthcare informatics is defined as the integration of healthcare science, computer science, information science, and cognitive science to assist in the management of healthcare information. HIE, Health Information Exchange. Health Information Exchange is the mobilization of healthcare information electronically across organizations within a region, community, or hospital system. Participants in data exchange are called in aggregate health information networks. HIMSS, Healthcare Information and Management Systems Society. The Healthcare Information and Management Systems Society is an American not-for-profit organization dedicated to improving healthcare in quality, safety, cost effectiveness, and access through the best use of information technology and management systems. HIPAA, Health Insurance Portability and Accountability Act. The Health Insurance Portability and Accountability Act of 1996, HIPAA, is a federal law that required the creation of national standards to protect sensitive patient health information from being disclosed without patients' consent or knowledge. HIS, Health Information Systems. A health information system, HIS, refers to a system designed to manage healthcare data. This includes systems that collect, store, manage, and transmit a patient's electronic medical record, a hospital's operational management, or a system supporting healthcare policy decisions. HIT, Health Information Technology. Health information technology is health technology, particularly information technology applied to health and healthcare. It supports health information management across computerized systems and secure exchange of health information between consumer, providers, peers, and quality monitors. HMN, Health Matrix Network. The Health Matrix Network was a global health partnership focused on strengthening health information systems in low and middle income countries, launched in May 2005 during the 58th session of World Health Assembly and dissolved on 31st May 2013. MPI, Master Patient Index. A Master Patient Index, also referred as a Patient Master Index, Patient Registry, or Client Registry, is an electronic database that holds demographic information on every patient who receives healthcare services. The MPI aims to accurately match and link records by uniquely identifying individuals. EMPI, Enterprise Master Patient Index. An Enterprise Master Patient Index or Enterprise-wide Master Patient Index is a patient database used by healthcare organizations to maintain accurate medical data across its various departments. Patients are assigned a unique identifier, so they are represented only once across all organization systems. NHIN, National Health Information Network. The Nationwide Health Information Network, NHIN, a program under Office of National Coordinator for Health Information Technology, ONC, was established in 2004 to improve the quality and efficiency of healthcare by establishing a mechanism for nationwide health information exchange. The NHIN is a set of conventions that provide the foundation for the secure exchange of health information that supports meaningful use. The foundation includes technical policy, data use, and service level agreements and other requirements that enable data exchange, whether between two different organizations across the state or across the country. NIST, National Institute of Standards and Technology. NIST is a non-regulatory federal agency within the United States Department of Commerce. NIST's mission is to promote U.S. innovation and industrial competitiveness by advancing measurement science, standards, and technology in ways that enhance economic security and improve our quality of life. PACS, Picture archiving and communication system. A picture archiving and communication system is a medical imaging technology which provides economical storage and convenient access to images from multiple modalities. PHIE. Public Health Informatics. Public health informatics has been defined as the systematic application of information and computer science and technology to public health practice, research and learning. It is one of the subdomains of health informatics. PHIE is also known as Protected Health Information. Protected health information under the US law is any information about health status, provision of health care or payment for health care that is created or collected by a covered entity and can be linked to a specific individual. PHR. Personal health record. A personal health record is health record where health data and other information related to the care a patient is maintained by the patient. RHIO. Regional Health Information Organization. A regional health information organization, also called Health Information Exchange Organization, is a multi-stakeholder organization created to facilitate health information exchange. ROI. Return on investment. How is ROI calculated? In its most basic form, ROI is calculated as follows. ROI equal to benefit minus cost divided by cost. That is the financial benefit after an investment or improvement is made minus the cost of the investment or improvement calculated as a percentage of those costs. Benefits are revenue generated, cost reduction, cost avoidance, productivity improvement, and costs are like labor expenses, time expenses, tool expenses. SNOMED CT. SNOMED CT. Systemized nomenclature of medicine, clinical terms. The systemized nomenclature of medicine is a systematic computer processable collection of medical terms in human and veterinary medicines to provide codes, terms, synonyms and definitions which cover anatomy, disease, finding, procedures, microorganism, substance, etc. SAMHSA. Substance Abuse and Mental Health Services Administration. The Substance Abuse and Mental Health Service Administration is a branch of U.S. Department of Health and Human Services. SOA. Service-Oriented Architecture. SOA or Service-Oriented Architecture defines a way to make software components reusable via service interfaces. These interfaces utilize common communication standards in such a way that they can be rapidly incorporated into new applications without having to perform deep integration each time. SOAP. SOAP. Simple Object Access Protocol. The Simple Object Access Protocol, SOAP, is a lightweight XML-based protocol for exchanging information in a decentralized distributed environment. By combining SOAP-based request and response with a transport protocol such as HTTP, the Internet becomes a medium for application to publish database-backed web services. REST. R-E-S-T. Representational State Transfer. Representational state transfer is a software architectural style that defines a set of constants to be used for creating web services. Web services that conform to the REST architectural style called RESTful web services provide interoperability between computer systems on the Internet. SSL. Secure Socket Layer. Secure Socket Layer (SSL) is a standard security technology for establishing an encrypted link between server and a client, typically a web server, website, and a browser or mail server and mail client, e.g. Outlook. DRG. Diagnosis Related Groups. What is DRG? Diagnosis Related Group, a classification system that groups patients according to principal diagnosis, presence of surgical procedure, age, presence or absence of significant comorbidities or complication and other relevant criteria. Or a classification of hospital case types into groups that are clinically similar and are expected to have similar hospital resource use. The grouping are based on diagnosis and may also be based on procedure, age, sex, and the presence of complications or comorbidities, or grouping system of hospital admission. DICOM, DICOM. Digital imaging and communication in medicine. Digital imaging and communication in medicine is the standard for communication and management of medical imaging information and related data. DM. Disease management. Disease management, the process of discussing and agreeing to treatments and care plans for individuals with long-term healthcare needs. EDI. Electronic data interchange. Electronic data interchange is the concept of business electronically communicating information that was traditionally communicated on paper, such as purchase orders, invoices. The technical standards for EDI exist to facilitate parties transacting such instruments without having to make special arrangement. Electronic data interchange. ESI. Electronic signature infrastructure. Electronic signatures and infrastructures, ESITC, is responsible for electronic signatures and infrastructures standardization within ETSI, develops generic standards, guides, and reports related to electronic signatures and supporting infrastructures. EMAR, Electronic Medication Administration Record. Electronic Medication Administration Record, EMAR, technology that automatically documents admissions of medication into certified EHR technology using electronic tracking sensor, for example radio frequency identification, RFID, or electronically readable tagging such as barcoding. EDAS-RX, Electronic Prescribing. Electronic prescribing, e-prescribing system are computer applications designed for use by clinicians to generate paper or electronic medication prescription. They offer the clinician and the patient to the promise of safer prescribing and improved office efficiencies. Two major drivers for adoption of such system. EMDS, Essential Medical Data Set. Essential Medical Data Set, EMDS, connected to DEEDS, is a standardized medical history data set containing element demographic, problem list, medications, allergies, and previous critical encounters. The data definitions in DEEDS are identical to those in EMDS. FACTA, FACTA, Fair and Accurate Credit Transaction Act. The Fair and Accurate Credit Transaction Act of 2003 is a United States federal law passed by United States Congress on November 22, 2003 and signed by President George W. Bush on December 4, 2003. Is an amendment to the Fair Credit Reporting Act. GPWW, Group Practice Without Wall, a physicians consortium in which several practices merge with intention of providing consulting to each other and to share expenses but not within the same premises. HITECH, Health Information Technology for Economic and Clinical Health. The Health Information Technology for Economic and Clinical Health Act, HITECH, is a part of American Recovery and Reinvestment Act, ARRA, of 2009, and creates incentives related to healthcare information technology, including incentives for the use of electronic health record EHR system among providers. HITSP, the American National Standards Institute, ANSI, Healthcare Information Technology Standards Panel, HITSP, was created in 2005 as a part of efforts by the Office of National Coordinator for Health Information Technology, ONC, part of the United States Department of Health and Human Services, to promote interoperability in healthcare by harmonizing health information technology standards. Health Information Technology Standard Panel, SCPCS, Healthcare Common Procedure Coding System. The Healthcare Common Procedure Coding System (SCPCS) is produced by the Centers for Medicare and Medicaid Services (CMS). SCPCS is a collection of standardized codes that represent medical procedures, supplies, products, and services. HCPCS. On November 4 to 2020, the Centers for Medicare and Medicaid Services (CMS) published the final rule in the Federal Register for calendar year 2021 Home Health Prospective Payment System (HHPS). The rule is effective January 1, 2021. Each year, CMS publishes updates to the regulation for inflation factors, wage index adjustment, and other patient care related payment adjustment. HHPS Home Health Prospective Payment System. IDS Integrated Delivery System, or IDN Integrated Delivery Network. An integrated delivery system, IDS, also known as Integrated Delivery Network, IDN, is a health system with the goal of logical integration of the delivery provision of healthcare as opposed to a fragmented system or a disorganized lack of system. LOINC, LOINC. Logical observation identify names and codes. Logical observation identify names and codes, organized by Regents Reef Institute in 1994. Ongoing support from NLM and Regents Reef. Course domain of clinical observation, laboratory observation since 1995, clinical observations in 1996, a universal code system that facilitates exchange, pooling, and processing of results. LTPAC. Long-term post-acute care. LTPAC providers include hospice, assisted living facilities, skilled nursing facilities, SNFs, inpatient rehabilitation facilities, long-term care hospitals, LTCHS program of all-inclusive care for the elderly, PSCE programs, and others. MGMA Medical Group Management Association. As the leading association for medical practice administration and executive since 1926, MGMA helps improve members' practices through exclusive member benefits, education resources, news, information, advocacy, and networking opportunities, and produce some of the most credible and robust medical practice economic. MEDLINE, MEDLINE. Medical Literature Analysis and Retrieval System Online. MEDLINE, Medical Literature Analysis and Retrieval System Online, is the U.S. National Library of Medicine's premier bibliographical database. It concentrates on biomedical sciences and contains over 12 million references to journal articles in life sciences. MMA Medicare Modernization Act of 2003. The Medicare Prescription Drug Improvement and Modernization Act of 2003 MMA requires that these individuals receive their prescription drug coverage through Medicare, not their state Medicaid program. MFS Medicare Fee Schedule. On January 1, 1992, the Medicare program unveiled a new method for paying physicians known as Medicare Fee Schedule, MFS. The new fee schedule is a complex system of administrative pricing based on the resource inputs used in producing physician services. MDS Minimum Data Set for Long-Term Care. The Long-Term Care Minimum Data Set, MDS, is a standardized primary screening and assessment tool of health status, which forms the foundation of the comprehensive assessment for all residents of long-term care facilities certified to participate in Medicare or Medicaid. MDS-2 Minimum Data Set Version 2. The Resident Assessment Instrument Minimum Data Set Version 2, RAI MDS 2.0, is a comprehensive standardized tool to assess residents in long-term care (LTC) settings. MU, Meaningful Use. Meaningful Use is the federal incentive program introduced in 2009 to promote the use certified electronic health record EHR technology among healthcare providers. NAHIT, National Alliance for Health Information Technology. The National Alliance for Health Information Technology, or NAHIT, was formed in 2002 in an effort to promote the use of health IT. Its members consisted of healthcare providers, peers, pharmaceutical companies, and other industry organizations. The group ceased operation on September 30, 2009. NCHS, National Center for Health Statistics. The National Center for Health Statistics is the principal agency of U.S. Federal Statistical System, which provides statistical information to guide actions and policies to improve the public health of American people. NCCI, National Correct Coding Initiative. The Center for Medicare and Medicaid Services, CMS, National Correct Coding Initiative, NCCI, promotes national correct coding methodologies and reduces improper coding, which may result in inappropriate payments of Medicare Part B claims and Medicaid claims. And NLM, National Library of Medicine. The National Library of Medicine is the world's largest biomedical library and a leader in research in computational health informatics. NCCI, National Correct Coding Initiative. The Center for Medicare and Medicaid Services, CMS, National Correct Coding Initiative, promotes national correct coding methodologies and reduce improper coding, which may result in inappropriate payments of Medicare Part B claims and Medicaid claims. NDC, National Drug Code. The National Drug Code is a unique 10 or 11-digit 3-segment numeric identifier assigned to each medication listed under Section 510 of the U.S. Federal Food, Drug and Cosmetic Act. The segments identify the labeler or vendor product within the scope of the labeler and trade package of this product. NCPDP, National Council for Prescription Drug Program. The National Council for Prescription Drug Program, NCPDP, is a not-for-profit ANSI-accredited standards development organization with over 1,600 members representative virtually every sector of the pharmacy services industry. NPSGS, National Patient Safety Goals. The National Patient Safety Goal is a quality and patient safety improvement programs established by Joint Commission in 2003. The NPSGs were established to help accredited organizations address specific areas of concern in regards to patient safety. NPDB, National Practitioner Data Bank. The National Practitioner Data Bank is a database operated by U.S. Department of Health and Human Services that contains medical malpractice payment and adverse actions reports on health care professionals. NPI, National Provider Identifier. NPI, National Provider Identifier. Number is a 10-digit numerical identifier used to identify an individual provider or healthcare entity. NUBC, National Uniform Billing Committee. The National Uniform Billing Committee is the governing body for forms and codes used in medical claims billing in the United States for institutional providers like hospitals, nursing homes, hospice, home health agencies, and other providers. The NUBC was formed by the American Hospital Association in 1975. NLP, Natural Language Processing. Natural language processing is a subfield of linguistic computer science and artificial intelligence concerned with the interaction between computers and human language, in particular how to program computers to process and analyze large amounts of natural language data. NHIN, Nationwide Health Information Network. National Health Information Network describes the technologies, standards, and laws, policies, programs, and practices that enable health information to be shared among health decision makers, including consumers and patients, to promote improvement in health and healthcare. NHIN, E. NHIN Health Information Exchange. Nationwide Health Information Network Exchange. Health Information Exchange (HI) is the sharing of clinical and administrative healthcare data among healthcare institutions, providers, and data repositories. The NHIN is designed to securely link regional and state. HI is to create national interoperable network of networks for sharing healthcare data in the USA. OSHA, Occupational Safety and Health Act of 1970. The Occupational Safety and Health Act of 1970 is a U.S. labor law governing the federal law of occupational health and safety in private sector and federal government in the United States. It was enacted by Congress in 1970s and was signed by President Richard Nixon on December 29, 1970. OBRA, Omnibus Budget Reconciliation Act. The primary goal of OBRA is to establish uniform standards for nursing homes and ensure the protection and safety of patients. For example, under OBRA, nursing homes must be inspected annually. OLAP, Online Analytical Processing. Online Analytical Processing, or OLAP, is an approach to answer multidimensional analytical queries swiftly in computing. OLAP is a part of broader category of business intelligence, which also encompasses relational databases, report writing, and data mining. OASIS, Outcomes and Assessment Information Sets. Outcome and Assessment Information Set, OASIS. OASIS is a group of standard data elements developed, tested, and refined over the past 2 decades through research and demonstration program funded primarily by the Centers for Medicare and Medicaid Services (CMS). OASIS data elements are designed to enable systematic, comparative measurement of home health care patient to outcomes at 2 points in time. OPPS, Outpatient Prospective Payment System. Payment per service, not per day or per case. Not all procedures are paid. Some are packaged with significant procedure. For example, low-cost drugs and supplies are included in the cost of surgical or emergency room procedures. PDSA, Plan Do Study Act Cycle. PDSA, or Plan Do Study Act, is an iterative 4-stage problem-solving model used for improving a process or carrying out change. When using PDSA cycle, it is important to include internal and external customers. They can provide feedback about what works and what doesn't. PDCA, Plan Do Check Act, or Plan Do Check Adjust. PDCA is an iterative 4-step management method used in business for the control and continuous improvement of processes and products. It is also known as Deming cycle, circle, or wheel. PPO, Preferred Provider Organization. With PPO plan, employees are encouraged to use a network of preferred doctors and hospitals. These providers are contracted to provide service to plan members at a negotiated or discounted rate. Employees generally are not required to designate a primary care physician, but will have the choice to see any doctors or specialists within the plan's network. POA, Present on Admission. POA is defined as being present at the time of the order for inpatient admission occurs. Conditions that develop during an outpatient encounter, including emergency department observation or outpatient surgery, are considered POA, Present on Admission. POS, Point of Service Plan. A point of service plan is a type of managed care health insurance plan in the United States. It combines characteristics of health maintenance organization and preferred provider organization. The PO is based on managed care foundation, lower medical cost in exchange for more limited choice. PPS, Prospective Payment System. A prospective payment system, PPS, is a method of reimbursement in which Medicare payment is made based on predetermined fixed amount. The payment amount for particular services derived based on the classification system of that service. For example, diagnosis related groups for inpatient hospital services, PHC. Personalized healthcare. Personalized healthcare, PHC, is an overarching framework for care that unifies predicative technologies with an engaged patient to coordinate care with primary aim of promoting health and preventing disease. PHCCC. Population health and clinical care connections. Information and resources focused on integrating public health and clinical care. RAID rate. Redundant arrays, independent or inexpensive disks. RAID is a data storage virtualization technology that combines multiple physical disk drive components into one or more logical units for the purpose of data redundancy, performance improvement, or both. RVU. Relative value unit. Relative value units are measure of value based in the United States Medicare reimbursement formula for physician services. RVUs are the part of resource-based relative value scale. ROI. Release of information. Release of information in healthcare is critical to the quality of the continuity of care provided to the patients. It also plays an important role in billing, reporting, research, and other functions. Many laws and regulations govern how, when, what, and to whom protected health information is released. RFI. Request for information. A request for information is a common business process whose purpose is to collect written information about the capabilities of various suppliers. Normally it follows a format that can be used for comparative purpose. An RFI is primarily used to gather information to help make decisions on what steps to take next. RFP. Request for proposal. Request for proposal. A request for proposal is a document that solicits proposal, often made through a bidding process by an agency or company interested in procurement of commodity, service, or valuable asset to potential suppliers to submit business proposal. RBRVS. Resource-based relative value scale. Resource-based relative value scale is a schema used to determine how much money medical providers should be paid. It is partially used by Medicare in the United States and by nearly all health maintenance organizations. SNF. Skilled nursing facility. Skilled nursing facilities, SNFs, that provides services including audiology and speech language pathology services to Medicare, and beneficiaries are paid under a prospective payment system (PPS) through Part A of the Medicare benefit. SNF PPS. Skilled Nursing Facility Prospective Payment System. The Balanced Budget Act of 1997 mandates the implementation of a per dime prospective payment system (PPS) for skilled nursing facilities. SNFs covering all costs, routine, ancillary, and capital related to the services furnished to beneficiaries under Part A of the Medicare Program. SDOS. Standards Development Organizations. An organization works to create uniformity across producers, consumers, government agencies, and other relevant parties regarding terminology, product, specification, e.g. size, including unit of measure, protocols, and more. Its goal could include ensuring that companies A's external hard drive work on company B's computer. SCHIP. State Children's Health Insurance Program. The Children's Health Insurance Program, CHIP, formerly known as the State Children's Health Insurance Program, SCHIP, is a program administered by United States Department of Health and Human Services that provides matching funds to states for health insurance to families with children. The program was designed to cover uninsured children in families with incomes that are modest but too high to qualify for Medicaid. TPO. Treatment, Payment, and Operation. TPO stands for Treatment, Payment, and Operation. It is used to describe some of the circumstances in which covered entities are allowed to disclose patient information without the need to obtain authorization from patients. TLS. transport layer security. TLS is a successor to the secure socket layer SSL. Transport layer security TLS is a protocol that ensures privacy between communicating applications and their users on the internet. UML, Unified Modeling Language, is a standardized modeling language consisting of an integrated set of diagrams developed to help system and software developer for specifying, visualizing, constructing, and documenting the artifacts of software systems as well as for business modeling and other non-software systems. UMLS, Unified Medical Language System. The purpose of the National Library of Medicine Unified Medical Language System UMLS is to facilitate the development of computer systems that behave as if they understand the meaning of the language of the biomedicine and health. The UMLS provides data for system developer as well as search and report functions for less technical users. UACDS, Uniform Ambulatory Care Dataset. The Uniform Ambulatory Care Dataset UACDS regulates the area of ambulatory care. The set includes reason for the encounter, living arrangements, and marital status. The UACDS is a recommended set, not a mandatory one. UHDDS, Uniform Hospital Discharge Dataset. The goal of the UHDDS is to obtain uniform comparable discharge dataset on all inpatients. The data elements can be categorized into four major categories: patient identification, provided information, clinical information of the patient, episode of care, and financial information. UPIN, Unique Physician Identifier Number. A Unique Physician Identification Number UPIN was a 6-character alphanumeric identifier used by Medicare to identify doctors in the United States. They were discontinued in June 2007 and replaced by National Provider Identifier or NPI numbers. UMDNS, Universal Medical Device Nomenclature System. The Universal Medical Device Nomenclature System UMDNS is a standard worldwide nomenclature for medical devices that has been officially adopted by many nations. It is produced by the ECRI Institute. UMDNS is a standard international nomenclature and computer coding system for medical devices. VHA, Veteran Health Administration. The Veterans Health Administration provides primary care, specialized care, and related medical and social support services to American veterans. VISTA-A, Veterans Health Information Systems and Technology Architecture. The Veterans Health Information System and Technology Architecture is a health information system deployed across all veteran care sites in the United States. WSA, Web Service Architecture. Web services are self-contained modular applications that can be described, published, located, and invoked over a network, generally the World Wide Web. The web services architecture describes three roles: service provider, service requester, and service broker, and three basic operations: publish, find, and bind. WG, Work Group. A working group or working party is a group of experts working together to achieve specified goals. The groups are domain specific and focus on discussion or activity around a specific subject area. WHO, World Health Organization. The World Health Organization is a specialized agency of the United Nations responsible for international public health. The WHO Constitution, which establishes the agency governing structure and principles, states its main objective as the attainment by all peoples of the highest possible level of health. W3C, World Wide Web Consortium. The World Wide Web Consortium is the main international standards organization for World Wide Web, founded in 1994, currently led by Tim Berners-Lee. The consortium is made up of member organizations that maintain full-time staff working together in the development of standards for the World Wide Web. UTF, Universal Character Set Transformation Format. A Unicode based on encoding such as UTF-8 can support many languages and can accommodate pages and forms in any mixture of those languages. Its use also eliminates need for server-side logic to individually determine the character encoding for each page served or each incoming form submission. URL, URIs and URNS. URL is a uniform resource locator, tells you the how and where of something. URN is a uniform resource name, is simply a unique name. URI is a uniform resource identifier, is URL or URN. Okay, that brings us to end of my presentation. Thanks for watching. I hope you would have found this information useful. If you like my videos, please subscribe to my channel.